Hey guys, welcome back. Today we will discuss about other topic, that is rehabilitation. The word is familiar to almost everyone. We will see the meaning of rehabilitation today. So rehabilitation. Rehabilitation means restoration of complete physical, mental, social, spiritual and psychological well-being of an individual. So here we are trying to get back the life of a person, or we will make the person to come back to the normal life with normal activities if they undergone any kind of problem which is stopping them to perform their daily day-to-day activities. So rehabilitation means restoration of complete physical, mental, social, spiritual and psychological well-being of a person, or it is a care that help you to get back to the present life. And what is the main aim of this rehabilitation means to improve your daily day-to-day activities and functioning. So that is the main aim of rehabilitation. So the formal definition from the Department of Health and the British Society of Rehabilitation Medicine. So what does the definition means? Rehabilitation is a process of assessment, treatment and management by which the individual and their family and the caregivers are supported to achieve their maximum potential for physical, cognitive, social, psychological functioning and participation with society and quality of living. So the simple meaning is restoration of physical, psychological, social and spiritual well-being. That means in the complete physical, mental, social, psychological well-being of a person after having some problems. So that is known as rehabilitation, and this is the formal definition of rehabilitation by DH, that means Department of Health and British Society for Rehabilitation Medicine. Well, coming to the indications of rehabilitations or who need this rehabilitation means the people who are suffering from injuries, traumas, stroke, fractures, burn, traumatic injuries or any kind of infections, surgeries like major surgeries, cancer treatment patients and those who are having side effect with cancer treatments, severe pain, developmental disabilities, mental illness, birth defects and chromosomal problems. So in these cases, we have to provide rehabilitation to the patient. So if you see these conditions, in every condition you can see one common factor, that is they need some help to perform their daily day-to-day activities, right? So rehabilitation team will get into that problem, will understand their problem, they will assess their problem and will assess their needs. Based on that, will plan the care and the treatment procedures. And what is the goal of rehabilitation? As I said, the goal of rehabilitation is specific. It is specific to each person, depend upon their situation. But while coming to the general goal, the goal is to help the patient to get their abilities back, to regain independence. For example, for stroke, the particular patient may need rehabilitation to do their daily activities like bath, dress, etc. without help, right? Stroke means paralysis of any part of the body. In that situation, after the condition, after getting treatment, sometime they'll come back to the life means in that stage, definitely they need support to do their activities. What type of activities? Daily day-to-day activities like bathing, dressing, etc. So how we can make arrangements to overcome these things, overcome this problem. So in that way, the rehabilitation team will plan their rehabilitation therapies and process. But an active person who has had a heart attack may need another type of rehabilitation process like cardiac rehabilitation exercises, cardiac exercise, etc. to strengthen their heart activities. Next, same situation for a developmental disability patient means, or a person with developmental disabilities means, in that stage or in that case the rehabilitation support is needed to improve their quality of life. So that's what I told you, the rehabilitation is specific to each person, depend upon their situation. And what is the rehabilitation procedure? So we cannot specifically say this is the rehabilitation procedure. As I said in the previous slide, it is specific to each person, but some common techniques which we are using in rehabilitation procedure we'll discuss in this slide. So assertive techniques sometimes we will use like tools, equipments, products, etc. to move and improve the mobility or functioning of the body. Sometimes any type of tools to improve the capacity of the hand, capacity of leg. Sometimes even a simple stretcher or the walker or a type of thing which can give support your hand and leg can consider as a assertive tool to improve your mobility. So that sometimes we'll use. Then, while coming to the cognitive rehabilitation, especially this will use for the people with developmental disabilities, learning disabilities, etc. So there, the techniques we will use to improve the thinking, learning, memory type of activities will be there, like puzzles, type of activities like chess to improve their memory capacities and their thinking capacity, and will give some situation to improve their decision making capacity, judgment capacity, etc., etc. Then other thing is mental health counseling. Those who are undergoing stress, those who are undergoing schizophrenia, those who are undergoing any kind of mental disorder and they need rehabilitation to overcome the problem, means in that stage mental health practitioners will give mental health counseling as a rehabilitation technique to overcome their problems as well as to perform the daily day-to-day activities. Then music therapies, art therapies, etc. to express their emotions. They have some suppressed emotions in their mind and we have to make them to talk about that emotions. Means sometimes directly if we talk they don't say their problems to you, but if we give some art therapy, music therapy, dance therapy, play therapy, means in that during the time of the therapy, once in a while if we listen, or if we have some time to listen, means definitely they will express their problem. So these type of therapies will help to express your feelings and also to improve the social interaction. See, in music therapy, dance therapy, art therapy, what we are doing, group of people are indulging in that process, right? So automatically their social interaction capacity will increase. The nutritional counseling, those who are having problem with imbalances in their nutritional status, those who are having eating disorder, in that stage nutritional counseling is considering as a rehabilitation procedure. Then occupational therapy, especially those who have problem to perform the daily activities, like simple activities like how to eat, how to dress, how to walk, how to brush, how to bath, how to tie the shoes, etc., etc., how to go to bank, how to go to school. Okay, so occupational therapy will help to improve the daily activities to perform the daily activities. Then physical therapy to improve the mobility and fitness. Those who have undergone severe fracture and took the treatment and while coming back to the life, physical therapy will help to the person to improve their mobility and fitness. Then recreational therapies like art, craft, drawing, aerobic exercise, walking, jumping, jogging, etc., etc. to improve their emotional well-being. Then speech and language therapies to improve their speech and language capacity. Then pain treatment. Pain treatment is also a type of rehabilitation process. Then vocational rehabilitations to help them to go to school, help them to go to workplace, help them to go to a bank and the legal advisors, etc., etc. So if we listen these things, definitely you can understand rehabilitation is not a simple thing, it is a complex thing. It is specific to each person, depend upon their situation. So if the patient is coming with stroke, their rehabilitation procedures and their rehabilitation planning is entirely different from a patient who is having developmental disability. Okay, guys. Then what is rehabilitation in psychiatry? So while coming to rehabilitation, psychiatry means it is specifically for psychiatric patients to recovery, to get relaxed or to get recovery from the mental illness. So psychiatric rehabilitation will help to maximize the individual quality of life and social inclusion by encouraging their skills, promoting independence and autonomy, to give them hope for the future and leading to successful community living through appropriate support. So while reading it will be little difficult, but if you take the meaning simple only. So rehabilitation psychiatry is basically or specifically focusing on the people who he or she is having psychiatric problems. So here what we are trying to do means through the rehabilitation psychiatry we will try maximum to improve the quality of their life. Those who are undergoing stress, they cannot focus on their daily activity. So rehabilitation will helps to overcome their stress. Rehabilitation psychiatric practitioners will focus on their stress and what is the causes of their stress, how we can overcome, and they will collaborate their work with the psychiatrists. They will collaborate their work with the people, those who are giving care to them, and integration of care we can see in rehabilitation psychiatry. Then there are mainly two type of rehabilitation. One is inpatient rehabilitation and one is community rehabilitation. Simple thing only. Inpatient means what? It will take place or it will give inside the hospital, and community rehabilitation means outside the four walls of the hospital. So the patient might be in the community, in the society, near to your school, near to your home, near to your college, or inside your college, inside your home. Okay, so in the community rehabilitation, a group of people, a team will work in the community, in the village, in the society, through the local healthcare services will provide the community rehabilitation services. And in inpatient rehabilitation, they will go to the hospital, or inside the hospital there is a rehabilitation therapy unit will be there. Their practitioners will be there, trained, registered, recognized practitioners will be there. They will plan the rehabilitation procedure. Okay, so this is about rehabilitation. So rehabilitation is nothing but restoration of complete physical, mental, psychological, social and spiritual well-being of a person. Hope you understand, guys.